Good evening, everyone, and thank you for being here with us today. I'm Giacomo Giorgetti, Junior Product Manager at Teethan and Biomedical Engineer. Today, we will discuss how Teethan can become a valuable ally in your dental practice. We will start with an overview of what Teethan is and how it works. I will show you how to interpret the reports, providing you with key information that can help you make more informed decisions for your patients. Additionally, I will share with you a brief clinical case that illustrates the practical application of Teethan and the benefits it can bring to the treatment of your patients. Hope you find this information useful and inspiring for your daily work. So, before diving into the webinar, I would like to tell you who we are. So, Teethan was founded in 2015 as a spin-off of BTS Bioengineering, a global leader in motion analysis. BTS already had an electromyograph used by the dentistry department at the University of Milan, led by Dr. Ferruccio Ferrario, a dentist and also an engineer. We combine our technology with his clinical experience to create a repeatable and a standardized analysis protocol that the dentists can use to quickly and easily assess the patient's occlusion. The system, as you can see in the slide, allows for a simple evaluation of the patient's occlusion, providing clear evidence of any muscular imbalances. It certifies both an initial pathological condition and a successful treatment, offering great satisfaction to you as a professional, making the patient happy, and providing a very important document for medical legal protection. So this last point is very, very important. Let me highlight the extensive work and commitment behind this innovative product, which we believe sets a new standard in the dental occlusion analysis. Teethan is not only patented, but also scientifically validated, with robust evidence documented in numerous scientific publications over the past 30 years. This substantial research baking underscores our dedication to accuracy and reliability. Furthermore, Teethan is entirely made in Italy, so development, production, and testing are all conducted on our soil, ensuring meticulous attention to quality. In creating Teethan, we focused on providing a tool that delivers consistent and repeatable results, minimizing any variability between operators. This is key to maintaining reliable and objective outcomes, whether administered by experienced clinicians or newer users. These foundational qualities allow Teethan to support clinicians in delivering precise and actionable insights, enhancing both the diagnostic process and the patient care. Now, let's delve into the technology and briefly describe the hardware components, starting with the probes. As you can see, each probe consists of a main electrode and a satellite electrode connected by a flexible cable. We also have a status LED that provides information regarding the probe status and metal cleats that allow us to attach the probes to the charger station, which we will see shortly, as well as the pre-gel electrodes for positioning the probes on the patient's face. Finally, we have the charging station, which in addition to allowing us to recharge the probes, also enables us to turn them on and off. Next to it is the USB receiver that provides a wireless connection between the probes and the software. Now we get to the heart of the Teethan protocol. So the first step is to position probes on the patient, and each probe is specific to a single muscle, and there is a label that helps you identify the correct one. You simply need to attach the Progel electrodes to each probe, remove the protective film, have the patient clench, locate the position of the muscle belly, and position the probe on the belly, keeping it parallel to the direction of the muscle fibers. We follow this procedure for both the temporalis and masseter muscles. Performing an occlusal test, including the time needed to position the probes, takes no more than 3 minutes. Regarding the patient's position, according to the protocol, they should be seated with body angles at 90 degrees to each other, feet flat on the ground, and arms relaxed on their legs. If you are more comfortable, you can also do it in the dental chair, tilting the backrest as much as possible while still achieving reliable results. The protocol consists of an initial calibration phase, which is necessary to set the machine on the patient. To do this, you need to place the cutter rolls between the patient's arches between the fifth and sixth teeth. So the patient should then clench for a maximum of 5 seconds on these cutter rolls. And in this way, we record a baseline, which is the best activity the patient can express unaffected by dental contacts. All subsequent tests will be compared to this result. This step needs to be done only once at the beginning of each visit. The next step is the actual occlusal test, where the patient must clench maximally for 5 seconds on their own teeth, allowing us to check whether the patient has a balanced occlusion. Once completed, the report will be automatically generated and saved, making it impossible to lose data. Now, I will show you a short video that summarizes the steps I just described. Well, so as you can see, the steps are very simple and the software interface is very intuitive. The first step is creating the patient profile. Once created, we move on to positioning the sensors, followed by the calibration test and the occlusal test. At the end of this final step, the report is automatically generated. Before diving into the analysis of each individual index, I want to highlight the occlusal plane, which displays two targets, so a pink one for the masseter muscles and the blue one for the temporalis muscles. Furthermore, there is a vertical gray normal range band referencing the barycenter, a pink normal range band referencing the masseter muscles, and a blue normal band referencing the temporalis muscles. In an ideal condition, the targets should be positioned at the center of the two green areas that mark the intersection point of the normal range bands. Of course, we understand that this condition is unattainable in a real patient. However, it serves as a reference point to determine where the actual target is located in relation to this ideal point. How far is it? How has it shifted relative to the point of balance? In this specific case, for example, we can observe a shift of the targets to the right, suggesting increased activity in the right side muscles during occlusion. Additionally, both targets are positioned forward relative to their respective normal range bands, indicating a higher workload of the temporalis muscles compared to the masseters. The goal is to bring the targets within the green areas, where the normal range bands intersect. This chart is particularly useful for explaining any identified issues to the patient in a clear and intuitive way. Now, let's start analyzing each individual parameter found in the report together. Let's start with this index. This is a neuromuscular balance index that ranges from 0 to 100 and is expressed as a percentage. Represents an overall score of the occlusion that allows us to immediately understand the patient's condition. We can think of it as a traffic light indicating the general condition of the patient. So a green traffic light indicates that the patient has good occlusal balance. So if we reach this goal, we know we have achieved the correct result. If we find a yellow traffic light, as seen in the case presented, it means that there are emerging issues that will lead the patient, if not immediately, to experience discomfort and could worsen over time. If we find a red traffic light, it means that the patient's occlusion is completely unbalanced. It is very useful for us to perform this type of test right from the first visit to evaluate the condition the patient presents in the dental practice. It's important to emphasize that this document has medical legal significance, as it provides important information about the patient who has just entered the dental practice and also serves to protect you. Now, let's focus on the indices and the type of support they can provide. Which one do we read first? Certainly the barycenter. So this index compares the activity of the masseter muscles with that of the temporalis muscle. The barycenter can be anterized, as we see in this example, when the temporalis work more than the masseters, or it can be posteriorized when the masseters work more than the temporalis. Clinically, what information does this give us? We know from the literature that temporalis act from the first premolar forward, while the second premolar is usually influenced by both muscles. But in general, it varies from patient to patient and is quite unpredictable. The molar area, however, is certainly under the control of the masseter muscles. In conclusion, if we have a barycenter that is strongly posteriorized, it means that the patient has an occlusal load completely shifted to the molar area. While if we find a strongly anteriorized barycenter, it means that the patient is loading on the anterior groups. What is the worst condition? Let's assume that being in extreme cases is never the right solution. However, uh, if we had to choose, we prefer a load slightly shifted backward compared to a load on the anterior groups. The reason is that patients with an interiorized barycenter often suffer from headaches, neck pain, and frequently have issues with the joint that experiences significant moments since an important lever arm is created. Often, patients with an interiorized barycenter break prosthesis in the premolar area, and without Teethan, it becomes very difficult to predict this. Whereas with the occlusal test, we can immediately understand the cause of a prosthetic fracture. For instance, when you have a new patient coming to your dental practice because they need to redo a prosthesis or because they are no longer comfortable with their dentist. Let's summarize the concepts discussed so far. A slightly posterized load provides more comfort to the patient, and we know that molars are teeth designed to support heavy loads. Whereas, as mentioned earlier, an anterior load can lead to various problems for the patient, some of which can be very serious. What is the simplest method to move it backward? Unless there are evident contacts in the premolar or incisal area that justify this significant activity of the temporalis, the simplest method to shift the barycenter backward is to perform posterior raises. Of course, Teethan does not give you an exact height, but you can proceed gradually and measure in another 5 seconds the effect of that occlusal raise and adjust it up or down relative to the initial raise. Once the barycenter is correctly positioned, the goal is to evaluate if there are still mediolateral imbalances. And to do this, we can check the POC, which stands for percentage overlapping coefficient, which tells us which of the analyzed muscle pairs is more active. This helps us understand if we have contacts that are causing a muscle to become overly active, or conversely, if there is a lack of contacts on the contralateral side. In this case, if there is difficulty in finding which contacts might be leading to this condition, it is advisable to perform a raise on the contralateral side of the more active muscle to rebalance the patient. To more easily determine the condition we are in, articulating paper can assist us. In the case of frostbite, it is very likely that the POC of the temporalis and masseter muscles will show opposite asymmetries, often generating muscle torsion. Muscle torsion occurs when a cross pair of muscles activates more than the other. In practice, this means that the muscles are attempting to apply a twisting force to the mandible, to the jaw, on the horizontal plane. The lower the activation percentage, the more significant the torsion. Alongside the percentage, we have indications of the direction of this torsion. The direction is always guided by the temporalis muscle. Therefore, when we observe leftward torsions, we know that the more active cross pair consists of the left temporalis and right masseter. This condition usually occurs in the presence of frostbite, premature contacts, or lateral deviation, for instance. If we return the POC to the physiological values, torsion will disappear, and we will no longer have to worry about it. This order of analysis of the indices allows us to standardize the evaluation of every report in any clinical context and to return the patient to optimal balancing. The only index that at this point may be still non-physiological is the impact. This index represents the overall work expressed by the four masticatory muscles and is calculated as the ratio of the work the patient expresses on their own occlusion to that expressed on the cut rolls during calibration, meaning when dental contacts are excluded. At this point, so once the patient has reached a good balance, means that all indices are in the physiological range, the impact is closely related to vertical dimension and how this is accepted by the patient from a functional point of view. If we still find a high impact, this suggests a vertical dimension that is too low, forcing the patient to exert excessive effort on their own occlusion. Conversely, a low impact indicates a vertical dimension that is too high, which does not allow the patient to express correct work. Most patients who tend to exceed 200% of this index are likely bruxists. Therefore, this index also acts as an alarm bell in managing these increasingly common cases. Now, I will tell you about a brief clinical case in which Teethan was essential for the doctor who recounted it, allowing her to resolve her patient issues. The patient presented to her dissatisfied with a removable prosthesis built by another professional and complained about the prosthesis breaking after only 14 days while eating simple salad. At first, the doctor thought the patient was lying and that he had broken it by dropping it. The doctor decided to repair the removal prosthesis, initially thinking of returning it to the patient this way. After a brief reflection, however, she decided to check the performance with an occlusal test. From the test, as you can see, a strongly anterized barycenter and muscle torsion emerge. The fracture line of the prosthesis perfectly coincided with the direction indicated by the targets. This made her realize that the prosthesis needed modification and that even with the repair made, the patient would break it again. So, she modified the prosthesis by giving more posterior contacts and repeated an occlusal test. As you can see, the barycenter is now in the correct position and the patient no longer called the doctor with problems regarding the prosthesis. Now, let's focus on the importance Teethan has for the doctor. Teethan allow her to predict further failure and resolve the problem before the patient manifested the issue again, creating dissatisfaction and risking losing him. Instead, she was able to retain him, and the patient continues to be followed by the doctor even after years. Furthermore, Teethan provides indications on how to proceed to improve a pre-existing prosthetic device, as well as giving guidance when embarking on a new project. The last point, not least, is to make the patient understand the necessity of treatment. I'm sure most of your patients are very loyal, but I believe that communicating to a patient that need for treatment with concrete data further strengthen what was already being explained verbally. In conclusion, Titan is a device that not only provides clinical support but also enables a more effective communication with your patients. In just a few seconds, you can test a patient's occlusion, a splint, a prosthesis, and more. This underscores that Titan can be used in various dental contexts, such as orthodontic, functional treatments, and whenever a modification to the patient's occlusion is intended, even after a simple filling. So, to conclude, I would like to show you some reviews from our customers. These words reflect the positive experience and added value that our product has brought to their practices. Their feedback not only confirms that positive impact of our product, but also motivates us to continue improving and innovating. Each review represents a success story and a step forward in our mission to provide the best for industry professionals. We are confident that you too can benefit from these results, and we would be excited to discuss this further with you. Before opening the floor for questions, I'd like to share a recent experience that I believe underscores the importance of having technology that can identify underlying issues and increase awareness for both patients and professionals. A few days ago, I visited a dental practice to assist a new client with a first Titan examination. The patient, a woman around 50 years, more or less old, has suffered from headaches and widespread facial pain over 10 years. She had seen several specialists, neurologists, psychologists, and other dentists, yet the issue remained unsolved. Recently, her symptoms had worsened following the placement of a temporary prosthesis. The dentist conducted a Teethan test, which revealed an occlusal load concentrated in the anterior right region. Together with his dental technician, he adjusted the temporary prosthesis in real time and repeated the test, achieving a physiological result. The patient, visibly moved, burst into tears of relief as she immediately felt more comfortable and finally understood the source of her problem. These are the moments that inspire us every day at Titan to take another step forward, to provide you with tools that make a real difference for your patients and ultimately for your practice. Before we conclude this webinar, I would like to remind you that you can ask questions through the Q&A tool in Zoom, located at the bottom of the screen. On this slide, you'll find our team dedicated to international markets. Our manager, Luis David Carcamo, is supported by a representative for each region, ready to meet your requests and needs naturally in your language. So, I remain available for any further questions. Okay, I would say there are no questions, but before closing, I want to emphasize that all our clients will be supported by us following the adoption of the technology in a dedicated training path to address any of your needs. Thank you again for your attention and have a good evening. Bye.